Good day! I'm Macey and I'm Villaflores from BSN1B, and I'll be reciting the infectious disease Syphilis. Before going to an in-depth discussion, let's first have an overview to this disease. Syphilis is one of the most common sexually transmitted disease from a bacterial infection. It is caused by a bacterium called Treponema pallidum. This disease is acquired through direct contact, and it is known to be chronic, since its clinical manifestations can be experienced by a person for a long time. Let's first head to the taxonomy and classification. It is from the kingdom Eubacteria, phylum Spirochaetes, family Spirocataceae, and order Spirocatales, genus Treponema, species Treponema pallidum, and its common name is Syphilis treponema. Let us now move on to the morphology and etiology of this disease. The only causative agent of syphilis is the Treponema pallidum, and it is under the spirochete, since it is a thin, delicate, highly coiled, corkscrew-shaped bacteria with tapered ends, and it has about 10 spiral. Its size ranges from 0.1 to 0.5 microns in width and 5 to 15 microns in length. This organism is difficult to grow in the lab since it requires complex culture media, and it is also too thin to observe in a light microscope, while for its staining reaction, the T. pallidum is a gram-negative bacterium. Also, it is an actively motile microorganism, which means that it has the ability to move rapidly since it has endoflagella which contains protein filament. This allows them to move around by twisting or turning, or kind of like how a drill works. The method of the division of Treponema pallidum is through binary contact, which is a form of an asexual reproduction. This occurs when the cytoplasm of a prokaryote divides into two, and this happens after the genetic material has been replicated. For the life cycle of T. pallidum, however, is not yet confirmed. This is because it's hard to study and monitor its growth and developmental processes, due to its size, and as said earlier, its cultivating process is really complex. Let's proceed to the general characteristics. Treponema pallidum predominates in the tropical areas of Africa, South America, India, Indonesia, and the Pacific Island. It is an obligate parasite, which means that it can only live inside the human body. It is also microaerophilic, which means that it needs oxygen in order to survive, but it only requires low levels of oxygen. Also, T. pallidum is highly prestigious and fragile since it can be deactivated by using extreme hot and cold temperatures, and it can be rapidly immobilized and killed by trivalent arsenics, mercury, and bismuth. Let us now head to the epidemiology. This is the chain of infection of syphilis, and it is important to know this particular chain since being knowledgeable with this can help us in preventing the disease and also in finding a way to treat it. The chain starts with the infectious agent, which is the pathogenic microorganism, and in this case, it's the Treponema pallidum. Next to the chain is the reservoir, which is where the infectious agent comes from. And T. pallidum is known to only live in human bodies since they are obligate parasites. Next to it will be the portals of exit, which is where the T. pallidum will live its reservoir, and it could be from the mouth, skin lesions, and genitals of the infected person. Next is the mode of transmission. Mode of transmission is divided into two ways. It can be acquired, which is when the T. pallidum enters via body fluids. This can happen when there are breaks in the skin or mucous membranes of the external genitalia or mouth, or when there's a sexual contact including oral, vaginal, or anal. It can also happen when people share contaminated needles, or with a direct contact to a skin lesion of an infected person, since that lesion is covered with fluids that is rich in spirochetes. Second type of the mode of transmission is the congenital syphilis. This can happen when a pregnant woman is infected with the disease. And T. pallidum can infect the baby either in the uterus or when exuding through vagina at birth. Next is the portals of entry, which are certain locations to where the pathogen have to get through in order to infect the host. It can be in the form of mouth, break in the skin or lesions, and external genitalia. Last one is the susceptible host, which is the one that will be infected by the T. pallidum. Humans are the only hosts of this bacteria, particularly those that are sexually active and those that do not practice safe sex. Regarding the prevalence of syphilis, the World Health Organization estimated that there are more than 1 million cases of sexually transmitted disease that are reported each day globally. For the annual data, 11 million new cases of syphilis are being reported every year. Let us move on to the pathogenesis and the pathophysiology. The primary stage is the first stage, which occurs 1 to 3 weeks after the infection. And this is the stage where the disease is highly infectious. And the most common signs and symptoms of this stage is the canker or ulcer that develops at the site of inoculation. It is simply the mark where the bacteria enter the body, and it usually heals spontaneously after 2 to 8 weeks. Next is the secondary stage, which occurs 6 to 12 weeks after the infection. During this stage, spirochetes enter the bloodstream. That is why the signs and symptoms of this stage include sore throat, swollen lymph nodes, body malaise, fever, weight loss, fatigue, and laryngitis. Next is the latent stage, which occurs months to years post-infection, and it is when the disease enters the dormant or asymptomatic stage. And this is actually more dangerous since the infected person and the physician cannot find any symptoms, therefore it will be harder to cure. In rare cases, syphilis can progress to tertiary stage, which can develop 10 to 30 years after the infection, and this affects multiple organ systems including the nervous and cardiovascular system. And its symptoms is the granulomatous skin lesions or guma, and this affects the spinal cord and the aorta, causing an inflammation. Next is the diagnosis. Visualizing a clinical specimen such as the skin lesions is one way to diagnose the syphilis, and this can be done using a dark field microscope, which shines a thin light on the slide so that the background appears dark. Then the extremely thin spirochetes light up. However, running a blood test or the serological test is more accurate, and it is used to confirm the diagnosis. It can be non-specific tryponomal test or specific tryponomal test. The non-specific tryponomal test detects the antibodies that are against the T. pallidum present in the body. For this test, the CSF will be collected in a lumbar puncture procedure. It includes the tests that are called RPR and VDRL. It is called non-specific since it detects antibodies that target various antigens, thereby it is not exclusive for treponema. For the specific tryponomal test, it detects antibodies that specifically and exclusively target the T. pallidum, and this includes FTA-ABS. Also, the result for this test will only state if a person is positive or negative. Now, for the treatment and management. When diagnosed in its early stages, syphilis is easy to cure. The preferred treatment at all stages is the penicillin, which is an antibiotic. The mechanism of action of the penicillin is the inhibition of cell wall synthesis, in which the cell wall of the bacteria is being targeted in order to inhibit its formation, and with that, it will be deactivated or altered. Therefore, the penicillin is bactericidal since it causes the bacteria to die. A single dose of benzathine penicillin G 2.4 million units is being used to kill the T. pallidum, and this is administered through an injection. For higher stages, it can be administered as 3 doses of 2.4 million units each at 1 week interval. While if the patient is allergic to penicillin, doxycycline is the preferred alternative. 100 mg of doxycycline can be taken orally twice a day for 2 weeks. Let's now head to the prevention. Any sexually active person is possible to acquire syphilis, especially if it's unprotected sex. So what the healthcare providers recommend is to use condoms and getting regularly tested for STDs. Mutual monogamy is another way to prevent this disease, which is when 2 partners agree to be sexually active only to one another. Knowing the risk factors of syphilis is the most important information that one can acquire in order to know how to prevent it. This includes having multiple sex partners, having a partner with multiple sex partners, having unprotected sex or not using condoms, and having an HIV infection. Lastly, the nursing intervention. First of all, nursing interventions are the actions that a nurse performs to provide care, order for the patient to reach their particular goal that are set for them. Aside from administering such medications as penicillin, one thing that a nurse can do is to provide the patient free supply of condoms. And this intervention is commonly done in the hospitals to the clients that has STDs. Educating the patient is another way of nursing intervention, such as telling the client that he or she must abstain from any sexual contact until the skin lesion is healed. It is also important to inform the patient on how syphilis is being transmitted and how to further prevent from being reinfected. Lastly, it is also a role to comfort the client by affirming them your support and commitment, and with this, they will be less anxious. That will be all. Thank you!